Well, prescription drug prices continue to outpace inflation. A new AARP study shows wholesale prices for brand name medications increased an average 7.1% last year. It's the largest increase in 5 years. The study looked at prices of more than 150 brand name drugs. Prescription drug prices jumped 35% since 1999. The inflation rate during that 5-year period was 13.5%. If you're among millions of Americans with low back pain, especially with pain radiating down the legs, you may have a serious condition called disc herniation. Now there's a treatment option you might want to check out before committing to surgery.
I had such severe lower back pain, I was having trouble sitting at my desk at work.
Cheryl Rossi tried everything to find relief from the pain in her back and down her leg.
And I was told to get up frequently, but even walking was painful. Getting out of bed in the morning was painful. Exercise was nothing. I couldn't do exercise.
X-rays showed Cheryl's pain was caused by a compressed disc.
It was terrible. I couldn't do anything. I got very depressed. I'm a very active, high-energy type person, and I just felt like I couldn't do hardly anything.
The key is when somebody has a disc herniation, what happens, the flow of blood, nutrients, oxygen, water are all restricted to the disc.
It's a serious situation, but Dr. Michael Pritzker uses a technology in his chiropractic practice that's changing the lives of back patients like Cheryl. It's called spinal decompression.
With spinal decompression, we're actually able to isolate the disc that has been herniated or degenerated in the low back and reduce the pressure inside the disc. This is the spinal decompression therapy table.
The patient is first strapped onto the treatment table at the chest and waist.
The waist harness is actually connected to a computerized system. What that computerized system does, it actually monitors the amount of pressure that we're putting into the disc. So if we have a disc space that has been lost, we're actually able to separate that disc space, creating negative pressure inside the disc.
When I tried out the device, I felt a pull in my lower back.
By the angle of pull, we're actually able to isolate the exact disc on their back that we're actually decompressing.
Many patients find relief from their pain in as few as 10 treatments.
It just feels like a nice, firm, but gentle stretch. It feels really good, like the way your back should feel.
What that allows is it allows the fluid and nutrients and blood and water to go back into the disc and restore its function. And when you do that, that's when you get people that reduce the back pain, the leg pain is reduced.
Cheryl admits she was nervous at first.
But once I noticed improvement after 2 or 3 visits, then I just was hooked. I mean, I don't have any lower back pain now, and I'm walking 5 days a week.
Before treatment on the disc compression system, patients do get thorough diagnostic workups, including x-rays and other scans. Approved by the FDA in 1999, some orthopedists and neurologists are joining chiropractors in using this technology. If you'd like more information, you can contact Dr. Michael Pritzker or call 1-888-867-4955.